once you know people well, you know, you become friends, you're part of their lives, you get invited to all these things.
I spoke to you last night and I said to you, my GP in Belfast, Dr. Paul McKeown, he was a GP, yet he was able to deliver me in hospital as well in those days. And we were used to the service that you offer, more or less, because he became basically a family friend. Doesn't happen anymore. It's not going to happen anymore. There's a crisis within your industry as well about practices, about people being attracted to being GPs. What state is your profession in, and what has the government to wake up to on this?
It's in a sorry state. They're not attracting young people into the profession. Older guys are leaving as fast as they can. And there's this move towards big impersonal practices, whereas patient number 25,062, you're seen by a GP number 17, who's never seen you before and might never see you again. And it sort of doesn't work, really, because you've really got to know someone well, particularly elderly patients, particularly chronic sick, where when we meet someone, we're on first-name terms, and we start from the point they want to start. We don't have to go right back through.
Well, you said last night they never have to repeat their history every time they come in and see you.
That's right, because it's all in here.
So what would you say if there are any young medical students watching who are maybe considering going into general practice or not sure? How would you sell that to them as loving it and being so passionate about it as you are?
Well, I would say don't be put off by the system. I think it's the system that's the problem. The job is actually very fulfilling. The patients are lovely, and you know, if you can concentrate on that, then it's a very worthwhile.
And what about your lovely wife sitting there to the right of you? Because so many of you talked last night. Everybody was so modest, Sue, weren't they? And all the nominees said, "Oh, it's team. It's about the team." I mean, you do have a great team, as particularly your wife.
Absolutely.
How important is it to have Sue and that team around you in your practice?
Oh, Sue's a vital part of the practice because she's not just a nurse, but she's also there to sort out problems and so forth. But because of our funding situation, we are very, very, very reliant on nurses, and they do a great job. So, in a sense, this is the future of general practice.
Also, what we were aware of last night was the teamwork within the NHS, and it was absolutely brilliant. And that extended outside to the pharmacists who were gathered into the rooms, the opticians who were there as well. And I want to mention Anne-Marie McLaughlin, who's a dispenser from Strabane with Boots, and Geraldine McCaig, who's with Child, and she's a pharmacist as well. And from Nottinghamshire in Southall, we've got to mention Leah Hubble.
All been slipped in your pocket last night,
all slipped in my pocket last night.
I wonder what.
Brilliant
phone
people.
Numbers.
Absolutely brilliant people out there. And is he ever going to retire soon?
Watch this space. Who knows? The kids are nagging him to retire. I think he needs to cut down a little bit, but John finds that hard to do, so we'll see.
Well, I'm sure your patients will really miss you the day you do, and it was lovely to meet you last night, and very, very well deserved health hero and hero of heroes.
Yes,
there's your award. Where are you going to put that?
I thought it'd be like Wimbledon. They'd have someone engraving the name on. They've just got the sponsor boots and the Daily Mail.
Thank you. Dr. John Cormack and his wife Sue, they are health heroes. Thank you very much indeed.